So who are we? The Association of Directors of Adult Social Services, made up of all of the serving statutory directors up and down the country, the people who report directly to us, and a large number of retired colleagues as well. Our aims are, as a charity, set out there, but essentially we look to try and advocate and inform policy development with and for the local people that we seek to serve, and to champion the role that the social care workforce plays in our society as well. Last year we set out a publication with our thoughts on the future. It was entitled Distinctive, Valued and Personal. For those of you interested in finding out more detail, www.adass.org.uk will give you some more detail. But in there, and the reason for putting this slide on, you will see that we think the future is personalised services, more joined up around individuals. We think that it's about good information and advice enabling people to make a choice. It's about building supportive relationships and communities, and it's about maintaining independence, and technology-enabled care has a role to play in all four of those, I would suggest. A little bit about social care being valued. Very often we get challenged when things go awry, but when this data was pulled together about 1 in 5 adults, it's getting closer to 1 in 4 now, had some direct insight into social care from their own lives or lives of other family members. And remarkably, despite the financial reductions of recent years, overall satisfaction with social care runs at about 91%. More than anything, that's a remarkable testimony to the frontline adult social care workforce, who make a real and meaningful difference to the lives of over 1 million people in our country, quite literally every minute of every day. Some numbers. There are about 1.3 million people working in the NHS, just over 1.4 to 1.5 working in social care, but about 5.5 million and growing numbers of informal unpaid carers and family members who make such an important contribution. I think we need to think about all of those people as potential champions to add to the 1.7 million people who already benefit from telecare. A little bit about resources. So what we've seen in recent years, by any measure, increasing demand. More people are living longer. They are often living with more complex conditions with multiple long-term needs. And rightly, they are living with higher expectations about the quality of life they expect to lead. Imagine you and I and the discerning customers of telecare or of social care that we will be in years to come. But all of that done at a time of decreasing resources, a 31% real terms reduction in the budgets of adult social care departments in councils in England over the last 5 years. We did some work and wanted to share, for those of you who haven't already seen it, some numbers about the extent to which telecare or similar things is being used, is being thought about or not being used. This was a 2014 survey there. Lots of numbers for you to get a feel for, but for you and I could do better in most of those boxes, I would suggest. It's worth thinking that change is fairly rapid. So when we did that survey in 2014, number of community alarm users, about 4,400 per council, multi-centre telecare users, about 1,700 per council, and then the answer to the question about is there a telehealth service in your area? 61% yes, 33% no, and 6% don't know. Said earlier, telecare users of about 1.7 million. Now, I want to say something about why I think change is rapid. I spent Friday evening, along with a number of colleagues, paying tribute to staff at the council I work in at Enfield in North London, to the winners of our long service awards. They'd worked for the council for 25 years or more. The leader of the council stood up and said, 25 years ago, the first ever page was posted on the internet. Quite profound change in those 25 years. So if we start to look at what we might think will happen in the next 20, some quite remarkable things that we haven't foreseen will happen. At the individual level, change can be very rapid as well. So the Fitbit, I don't know if any of you have got a Fitbit on or a similar kind of device that's connected to the apps around your activity, behaviour, nutrition, etc. So somebody very close to me has a very good friend. Let's call her friend Mrs. Jones. Her friend literally is called Mrs. Jones, I would say. who got a Fitbit. It was one of those that clips onto your waist. So the person close to me decided that they wanted one of the ones on their wrist. This quite literally was keeping up with the Joneses in every imaginable sense. Within a week of wearing that Fitbit, person was having a phone call with their sister. They realised that they hadn't done enough steps that day. They walked up and down the hall and the kitchen throughout this phone call with her sister and walked a mile during that time. Now, I know that says they talk a lot, which is true. However, I just want to suggest to you that that individual's behaviour was modified in a very short period of time by the presence of the app and the incentive that they had about doing things differently. So at an internet or an individual level, change can be pretty rapid. There's lots that we could do with the big data that your systems start to collect around individuals from the calls, the technology and other things. You probably need to help us make sure that we get consent at scale so that we can tackle the information governance issues around sharing that. The big data story that I always like is the New York one. So in New York, the sewerage department shared their big data mapping about their blockages with the environmental health department, who went and fined all of the restaurants who were chucking their fat out and causing the blockage in the sewer. So it's a very simple example about, if you think slightly outside the box about how you can share the information, what completely different gains you can get. But you will know from the information around falls and all sorts of other things that we could use that much more effectively and much more powerfully. So I think the benefits of telecare, technology-enabled solutions are not really that well understood. Now, you might think that is because that me and people like me and our listening skills are not what they might be, and I'm absolutely certain that there's some truth in that. But I'm also going to challenge you and suggest to you that just in any other market, you perhaps haven't transmitted or communicated those benefits as well as you might. And going forward, I think you need to think a great deal about who your customers are. Some of your customers may be state or representatives of the state in its different forms or agencies like me. I want to suggest to you that increasingly going forward, you will need to be marketing to individuals. Not just the self-funders in terms of paying with their own money for the resource, but increasingly people will be using personal budgets, be they health or social care budgets, and spending that and making very personal choices around the technology that they seek to use as well. So if you're going to get really rapid change and a lot of adopters, then I think you need to be having marketing strategies that are much more about individuals than they are about representatives of the state. When I look at the future from a local government or social care perspective, there are 3, possibly 4 words that dominate it. The 4th word, it won't surprise you to hear, is technology, but you know more about that than me, so I'm going to share the other 3. Devolved, increasingly, decisions and powers are going to be more and more devolved to individual local authorities, or more probably to collections of local authorities and other public bodies, so that they will plan and do things in their place at scale with much more local decision taking and much more local control. I think that's right. I think people who understand a place are more likely to make things change and succeed in that place. And I'm often heard to say that what works on an inner city council estate may well not work in a remote rural or coastal community. I think it's going to be integrated increasingly across health, social care and other public services, especially housing, in the way that Jeremy set out for you just now. And we will look for whole system, place-based approaches that will bring together public services and will try and make sense of how individuals and families and communities can contribute their assets, their skills and abilities alongside those that seek to work with and for them. But most of all, it must be personalised. Many people argue that social care has been at the advent of public sector reform in recent years. We've probably done more than most sectors to give our customers choice and control over what really matters to their quality of life. And so as we go forward and obsess about structural change, be that geographical, be that organisational, the most important change of all will be to remember our customers, the people who use our services, and crucially their family members and carers, so that they are at the heart of everything that we plan to do and that we do, and they've got as much choice and control as we can possibly afford them. I want to suggest an opportunity to you. That's a screenshot taken from the Victoria Derbyshire show a couple of weeks ago. I'm feeling vain now. It's the second photograph of me that I've put up there. The important thing there was that it signalled national publication to transform care for people with learning disabilities and autism and who have behaviours that challenge the more complex high end of need. NHS and ourselves saying very clearly that the number of NHS beds or the number of privately purchased beds for people with this range of needs will halve over the next 3 years because we want more community-based solutions, and we are determined that people will be able to live meaningful lives in their communities. Because of their level of needs, then I think there's going to be a real opportunity for technology to help us innovate further. There are many good examples of what can be possible now, but I think you want to get some of your skilled technology people alongside some people with learning disabilities, their family members and carers, to co-produce the sort of solutions that we will need in those community living settings going forward. We will have got some of it already, but I'm sure there's greater potential going forward, and there is going to be some real money behind effecting that change as well. The other opportunity, simply because of the scale and the number of people with dementia, is the opportunity around helping to improve the lives of people living with dementia through technology. An alliance of organisations, including the Alzheimer's Society, recently produced some good work in this space, suggesting that there are probably 3 main areas around safety, health and life enhancement where there is the potential for technology-enabled care to make a real difference to the growing numbers of people living with dementia. We tried to map and put all of this together in a sort of a honeycomb, I guess, to suggest some of the areas where we think that technology will be increasingly influential in our work and in what we commission for the future. You'll have other ideas to help us develop this diagram and extend it, and indeed it comes in part from some work that we did with Tunstall, and a chance to acknowledge the important contribution and the work that they've done with us over recent years. So we think there will be one sphere that's around individuals and their carers, to think about engagement, reducing isolation. I think that will be crucial with the apps and the work around technology in the future. So much dependency can be tracked back and linked to increased isolation and an acceleration in dependency. More that we can do around monitoring health and well-being and safety, all the kind of apps around memory support and other things in that space as well. Second sphere that I think we would talk about will be broadening that out with families and communities, the connectivity that I think that we can bring to coordinate activities, stuff around alerts, monitoring, reassurance that you all know very well. More around prevention and identifying risk, and crucially, much more about communication. I'm sure you've heard lots of people tell you that grandparents adopted Skype when it meant that they could talk to people overseas, or in my case, their granddaughter when she went to university. And finally, for frontline workers, I don't think our frontline workers in social care are technology champions in the way that I think we would wish them to be going forward. So I think if we can invest more energy in helping them with the technological tools that will help doing their job easier, then the potential for them to spread the good word about technology-enabled care, about more apps, about more digital solutions will increase exponentially. So think about it in those 3 spheres and do help us refine and improve this diagram. It's probably the one that we're going to use with lots of different audiences to talk about the potential. But finally, I want to leave you with another photograph, and this is my daughter. It gets mixed reactions, this diagram. Some people say, what's she doing, standing like that? Well, if you're wearing a cape, you've got to do the Superman pose. Other people will have a look at it and say, Bristol Uni, bright girl just over the bridge, despite her father, I know. There are probably a few women in the audience admiring the red shoes. A first laugh I heard, thank you. Kurt Geiger, Dad had to buy the graduation outfit. But the real reason for showing you a picture of my daughter like this is to suggest 2 components of what she's done that I think are part of our shared future. The first of which is that she did her degree in cellular and molecular medicine. She did a dissertation in the genome mapping of dementia risk. So this really big science stuff that is pushing the boundaries about what do we understand of genetics and the risks. And I think we will see a lot more of that. It might be not that many years away between you and I prick our thumb, release a bit of blood into an app that will tell us the genetic conditions or the viral conditions that we are currently experiencing. So I think there is a lot about big data and about genetics that will inform our world in the future. But what I'm really proud of is that she did that whilst volunteering on the dementia ward at the Bristol Hospital during meal times. So ultimately, I think we get a better future when we combine the best evidence at global scale with people with the right values and behaviours applying it in places that they understand and places that they care about. The best strategy doesn't work without the people, the values and behaviours, but the values and the behaviours will be much less effective if we haven't got the best available evidence to inform how we direct our energy. Thank you.